I'm Lee Emerson. I'm a case manager at the VA, and my job is to coordinate the interprofessional team outpatient services for all patients at the hospital. Jose Espinal is a 25-year-old Latino male suffering from polytrauma after an EID explosion 11 months ago. He's married to Maria, and he has an 11-month-old daughter named Iris. Although he has a strained relationship with his own parents, Maria's parents, Marta and Simon, are quite supportive and provide childcare as needed. His combat injuries include an amputation of his left leg above the knee, extensive bilateral soft tissue injuries, left hand soft tissue injury, injuries to his pelvis and bladder, an anorectal injury resulting in an end-descending colostomy, hearing impairment, traumatic brain injury, and PTSD. Over the course of his treatment, he's been on 23 different medications, including opioid and non-opioid painkillers, antibiotics, drugs to aid in his bowel functioning, and psychotherapeutic medications. To date, he's made great improvements. His GI issues have been managed, and the colostomy has been reversed. At present, however, he still has impairments in his decision-making, dizziness, and in dealing with the amputation. He also has decreased strength throughout, especially with his left hand, with his left hip and core, and some hearing impairment. Currently, Jose goes for team outpatient services 5 days a week. Although his condition is greatly improved, his progress has stalled, which is not uncommon for patients such as Jose at this stage of treatment. Lately, he's been avoiding his individual and couples counseling sessions, and he's having difficulty using his wheelchair and walker, and he does not want to wear his prosthesis. He exhibits some delusional thinking regarding what he needs to do to get on track. He's also having difficulties taking his meds at the right time and interacting with people. As a result, his treatment team and his family are frustrated, and they're at an impasse.
Hi, I'm Jose Espinal. I'm Corporal, United States Marine Corps. I just finished my fourth tour of duty in Afghanistan, Helmand Province. I encountered an IED, lost my leg, been recovering ever since. And it's been rough, but I'm determined to get back into my unit with the Devil Dogs, with my buddies, and just get back out there and keep kicking ass. In the meantime, the community out here has been extremely supportive. Raise some money. I'm gonna get a truck, and just gonna do some good stuff with my family. We're gonna move out and start all over. You know, make good things happen with that. I don't know where exactly, but we're gonna get back, and then eventually, once I get back to my guys, then everything will go back to normal. So some of my injuries, my left leg is gone. They're trying to fit me with this prosthesis, but it's a pain in the ass. It just hurts. It fucking hurts. You know, I don't know how other people do it, and all these medications they got me on. And it's fucking crazy. You know, I'm taking a tons of pills. You know, I had this bone growth on my ass. Couldn't even sit down for 15 minutes. I was on a prone table for the longest. Couldn't even take care of my baby daughter. And then, apparently I lost some hearing on my left ear. My hand is shot. But all I'm thinking now is that once I get that truck, everything's gonna be great. You know, because I'll be able to move around, and I won't have to deal with any of this stuff. You know, they can just put an attachment to the gas pedals and the brakes, and I'll be good. I'll be able to move around and take care of my family, go to Costco and buy groceries, you know, be productive instead of just sitting there, laying there. And then we can move, throw everything on the back of it, and we can just hit the road and go somewhere. Definitely away from all this craziness here until I get better and get back to normal. And my wife, I think she'll appreciate that. I had this affair, and My wife, of course, she's still mad at me. But I was being honest. I just wasn't gonna keep lying to her. So I don't get why she's still mad. I'm telling her the truth. It would have been worse if I was hiding it, but I'm not. I was being completely honest. What more does she want from me? It's there. She knows it's never gonna happen again. It was one of those things that just happened, and she wouldn't understand why I did it. I don't even know why I did it, but I was honest, and what more do you want from me? What?
My husband Jose is in the Marine Corps, and he just came back from his 4th tour in Afghanistan, where he was wounded, and he lost his leg. He suffered some head injury, his hand, hearing on the left side. We've all been working, he and I and my parents, on treatment. The doctors have been really great. They've been very supportive. They've given him a lot of options as far as recovery and moving forward, but he's just gotten to this place where I don't think he's dealing with it anymore, mentally. He's not going to his treatments. He's not practicing walking on his leg. He just keeps talking about getting this truck. Our community really stepped up when he came back and was injured and raised $45,000 for us for expenses and to help us out. And he's gotten into his mind that he's going to use that money and buy a truck and that everything's somehow going to go back to normal. And I just don't know what to do anymore. I just don't know what to do anymore. I mean, how are we supposed to move forward?
What do you mean you don't know what to do? I'm
Like,
gonna help out. We
saying
are
you're-
gonna move forward.
You keep saying you're going to, but you don't. Like, you're not. You don't go to your treatments anymore. You're not practicing on your prosthesis. Like,
Because they
how are
hurt.
things? I know, but how are things going to get better if you don't work at it?
Because it's not as easy as you think.
I'm not
and
saying it's easy, but you have to do something.
I am, and I'm telling you, once we get that truck, things are gonna change.
How are they going to change because of the truck?
I'll be able to help out. Right now, I can't do much.
But how is having the truck going to make anything different? You still won't be able to walk. You won't be able to go anywhere.
Yes, I will. They'll put attachments on the truck, and
Fine, so you can go from our house to somewhere in the truck. But how are you going to get out of the truck?
Yes, and buy groceries and bring them back. I'll get in and out onto the wheelchair, and so
You make it sound so easy, but you're not using the wheelchair now. All you do is sit around.
we're gonna do this. We're gonna move forward. You'll see it. That truck is gonna make a lot of difference in our lives, and we might as well take advantage of it. You're just so negative right now. You just have to.
Well, because I feel like I'm doing this all by myself.
And I get it, but
The whole community came together and they raised that money to help us with our home, with our bills, with our kid. And they're gonna look at this and think that you just wanted to get a stupid truck.
no, and then we appreciate all that, but that's gonna make our lives. They're trying to make our lives better. That truck is gonna make our lives better. That's what's gonna happen, and they'll see that. I'll be able to do stuff for the family. Right now, I can't. I'm in too much pain. I'm in too much stuff.
Well,
too
do you
many
think that's
crap.
just gonna go away because you bought a truck? You're still gonna be in pain. It's still gonna be hard.
being negative right now, and you just gotta think positive of the stuff that we can do.
How am I supposed to trust anything that you say? Like, you're gonna do all of this stuff, you're gonna take care of everything, but you're not doing it now.
Because I can't. I can't move around.
Well, how...
I can't.
Howard!
I don't know.
I don't even know how to talk to you anymore. How am I supposed to trust you to take care of us when, as soon as anything goes wrong, you find somebody else and go behind my back?
I told you that was a one-time thing, okay? And that was before I was going away, okay? And my head wasn't in the right place.
Well,
you know?
and I was pregnant and I needed you.
But I was there for you. You would have never known if I hadn't said anything.
I just don't know how to trust you anymore.
You can trust me because I told you. I was being honest and I told you the truth. You know, I'm not lying to you. I'm not hiding anything anymore.
Simon, Jose needs help.
I agree he needs help.
I mean, other thing about this truck.
The truck is delusional. The truck is in his head that it's going to solve everything, but the issue is that he's not thinking clearly, okay?
Maybe it's his medication. Maybe he's taking too many medications. We have to see his doctors, his therapist.
I don't know that it's our place to see them, but we have to figure out
Of course it's our place.
Well, first of all, with the HIPAA regulations, how are we going to force them to do something they don't want to do?
It takes
I understand.
time.
I understand it takes time, but we need to figure out a way to get him and his wife to do the right thing, to seek a coordinator or someone. He's probably taking too many medications. He doesn't want to take the prosthetic because he keeps saying that it hurts. It shouldn't be hurting.
I know. Maybe it needs to be adjusted. And besides, it's something that it takes time. I mean, he cannot just expect this to be walking around feeling like an athlete right away.
First of all, is he even seeing a psychiatrist or a psychologist? Because obviously that should be part of the plan.
That's the priority.
I think it's a priority, but obviously not only is he not thinking properly, but it's to the point where it's affecting our daughter. She's in a bad way. Maria's in a bad way,
But he's a good boy.
I don't know that he's that good. I mean, he had
Why not?
an affair, and the affair, he got an STD. She could have gotten really sick behind that.
It was one night stand, okay? And at least he was honest. I know somebody that wasn't that honest.
What are you talking about now? I don't know what you're talking about because
you don't.
That was something that you made up in your head about a colleague. Okay. And first of all, we're not here to talk about that. We're here to talk about how are we going to get this angel, okay, he's an angel, whatever. How are we going to get them back on track?
He's a good man. They have a daughter already. He just needs help.
Okay,
and we are here to support him and to help him out.
Okay, all right.
Okay?
And how do we do that?
Okay, we have to see if we can change the therapist that he has. Number one. Number two, talk to his doctor to see if his medications are not working out for him. He's too confused.
First of all
he has in his mind is truck. I want to help my family. I want to do good.
Well, I get that, and I get that that's crazy. But the issue is that, first of all, we can't just walk into his doctor's office and start talking without him consenting to it, and he's not consenting to anything. He's not doing what he's supposed to do to take care of himself. He's not following, he keeps thinking about a truck. All he wants to do is walk into GMC and buy a truck. And
Please, let's talk to him. Let's have patience with him. We have to have patience.
We need to get, this is what I think we need to do. We need to get Jose and Maria, two of us, and try to get a therapist in the room, talk about coordinating the care, making sure he gets psychiatric, making sure the prostheses are being fitted properly. So, because first of all, they have to agree with what we're saying. So we need to sit down with them and talk to them
first.
That's
what I'm saying.
As an interprofessional team, what recommendations do you have from your respective disciplines regarding how to move Jose and his family's treatment forward?